Hello again. The pharmacy department at Community Regional Medical Center added a new member to its team, a neonatal intensive care unit pharmacist. That pharmacist is dedicated to serving the tiniest of patients in the region. The 65-bed, 20,000-square-foot floor is home to infants with the most critical needs. With the unit's leading-edge technology, there is an added layer of higher care because they've added their own pharmacy and pharmacist dedicated to these babies who need special treatment.
Clinical pharmacist Harlan Husted joined Community Regional Medical Center's Level 3 neonatal intensive care unit to tend to our valley's tiniest patients.
We can be looking at infants that are about 500 grams or less, and that's about the size of a Pepsi can, full.
Community Regional has the largest, most comprehensive high-risk antepartum unit in the valley and receives patients from 15 other area hospitals because of its expertise in caring for high-risk pregnancies and deliveries.
That's cross-section of the abdomen.
Since we are a birthing center, the mothers will be able to come down from the floor above and come down to see their babies, whereas in the past they were having to wait until they were released from the hospital, then they can go across town or anywhere else their babies are being held until they're ready to go home.
As a Level 3 NICU, Community Regional is the only hospital in the valley that allows moms and babies to be together, and Dr. Husted spends most of the day monitoring the baby's pharmaceutical and nutritional needs.
What we're able to do here is just manage their care until they're fully developed and big enough to go home. They're able to feed properly, and their medical problems are pretty much resolved by the time they're ready to go home from here.
While the babies are receiving treatment at the hospital, Dr. Husted also makes sure they are receiving proper nutrition through a total parenteral nutrition bag.
The protein, the sugar, any of the vitamin requirements that they're going to need, and we're going to be evaluating those based on our labs that we receive on a daily basis. So from one day to another, we're going to be having different medications and different balances of nutrients going into these bags.
Having this specialized care means the babies are closely monitored by a highly trained team of experts.
The pharmacist will be rounding with the doctors and the medical team on each patient, so we'll be able to see and make recommendations on any kind of medication needs we see.
Director of Community's Regional Pharmacy, Dr. Danny Vera, says that having an NICU pharmacist on the floor is invaluable.
Within the NICU, and that was another part of our design, there will be a dispensing satellite that is located in the nucleus of the NICU.
And this expert is very welcome.
Our addition of the NICU pharmacist is extremely important for the entire department.
Dr. Husted agrees.
We'll be able to accommodate them right there, and we'll be able to make any kind of recommendations that need to be done at that point.
Babies are born at all hours of the day or night, so other clinical pharmacists are being trained to take on these tiny patients.
Since we know that one individual cannot be here 24/7, 365 days a year, that we, again, can provide the competencies and training for our other staff members within the department. So they have the competency, the confidence to provide care for those sick babies.
Dr. Husted says, along with specialized care, it's the best thing for moms and babies to be together.
With the valley birth rates increasing constantly, we are going to need more and more facilities that are able to accommodate more of these premature infants that are coming through.
Moving forward with new medicine, new doctors, and new facilities. That's why Community Regional prides itself on being the region's only academic medical center providing babies with the best care possible. For more information on Community's neonatal intensive care unit, go to medwatchtoday.com.